Hey, what's up, guys? Welcome back to another episode of Influence Me. We are happy to be back. For those of you who follow me on Instagram, notice that I had to take a little bit of a break due to some surgeries that I had to get performed. But I am back. We are back. The team is back. And today, our guest, I'm very excited. I'm a little nervous just because it's a little different from what I do. But I wanted to bring him on because he's obviously saved my life, and he's a big part of why I'm here right now. So, ladies and gentlemen, today with us,
Rocco Tutela.
Thank you for being here.
Yeah, of course. Adrian.
I appreciate your time. I know you're really busy. Just you being here is kind of like a little surreal, a little bit, just because you were inside, or
inside,
not you necessarily. You were like inside my,
you don't get too more intimate than operating on someone. So I appreciate you having me here, and looking forward to talking.
Yeah. So for those of you who don't know, I recently got my gallbladder removed. We're gonna talk a little bit of the reason why in a minute. But before we go ahead and do that, let's go into your backstory of your upbringing. Did you have any family members that were doctors or in this field?
Yeah, so I'm actually a third generation surgeon. My grandfather, I guess, kind of led the way in becoming a physician. He was the first one to graduate college and went on to medical school. This is back in the early 1900s. He was a graduate of University of Notre Dame, went on to Loyola Medical College, and kind of spearheaded the way for the rest of us. During that time, he between high school and college, he wasn't able to afford college. Spent 2 years cleaning spittoons in a local pub, earned his way. His family helped him, supported him through college as well. Kind of did the same thing after graduating University of Notre Dame. Couldn't afford to go to medical college. Spent another couple of years working, and finally made his way through medical school.
Difficult process.
Tough. And I don't know where his drive came from. It's just really amazing. He was one of 11, actually the youngest of 11 children, and the first and only one to graduate college at that point.
So he was some sort like your motivation, or like your.
Yeah, I guess he would be the patriarch of the family, kind of like the one who kind of like lifted our family, from that level, post oppression. Hardworking. I think everybody in his family was pretty hardworking, back and forth, to Italy. But he was the one that kind of everybody gathered around and got him, saw I guess a little bit of a spark in him, and knew he was a little more motivated maybe to go down the academic route, and that's where things kind of led off.
So how did you start? I mean, obviously you would see that, but what motivated you to follow that?
So so my father, I would, quote unquote, say followed his footsteps. Went to University of Notre Dame as well, and went on to become a surgeon. And I just remember growing up, kind of being that little kid in the doctor's office, in the back corner, going through the lollipop drawer, and just seeing his interaction with his patients. My father took me, I guess under his wing at a very young age as well, and would take me on rounds in the hospital. And I just would see how everyone from the orderlies to other physicians to patients just, we're so happy to see him. And I just knew in the back of my mind, I was like, whatever he's doing right now. And I was 6 or 7 years old. I was like, I want to do what he's doing. And so it was kind of exciting to see that at a young age.
When you started school, there was no other career that you thought during the process of, obviously you in college?
Right.
Was there something else besides?
So my father gave me some really great advice, and I had said when I went to college, I said, "Look, I definitely want to become a physician," and I didn't love like the biology or the chemistry. He's like, "Listen, man, this is your 4 years to do something other than what you're going to do for the rest of your life.
Mm.
This is the essential of a liberal arts education is go out there, like make your bones." And do your pre-med stuff, so you kind of do your pre-med requirements, but go look out for other things that you have interest in. And I actually graduated with a political science bachelor's, did a minor in Italian language and culture,
Wow.
and just kept on with the sciences. Took my MCAT and kind of took things from there. My senior year, I also did a internship or clerkship with a lawyer at the public defender's office in Rochester. I went to University of Rochester, upstate New York, and just had some other experiences to say, hey, listen, is this definitely what I want to do with medicine? Because
Right.
you don't really get that clerkship in college the way that you would maybe in a legal department or in business and things like
Right,
that.
right.
Like you can't really get into the OR as a college student. Maybe you could, but it's so superficial that you don't kind of get that understanding. So that a lot of that came from my father, was kind of instilled in me. He didn't really push me to do it, which I think is a good thing, because I think medicine is one of those careers that really needs to be a passion, because 4 years of medical school is tough, and then residency after that is really
Yeah,
tough.
that's what
And
I
if
was gonna
you're-
ask you. How long is the process? Because you're what kind of surgeon are you? Are you just specifically for the gallbladder or the stomach or the GI system, or
Right.
what do you?
So I'm what you would call a general surgeon. So that involves, I would say, that the GI tract. So it's a lot of gastrointestinal surgery, hernias, gallbladders, colons. I kind of explain my area. My domain is basically here. So
Okay.
anything under the diaphragm, above the pelvic floor, is kind of where I do most of my work. So no thoracic, no orthopedics,
Okay.
and things like that.
So how was that? How long is that process? Were you like, does the GI have a certain, like you're saying you're general, so that means like overall you had to study for one specific type of, to be a specific type of surgeon?
Right. So 4 years of medical school, after 4 years of college, and then you do a residency program. Typical residency programs for the medical fields are 3 years. For surgery, it's a 5-year program. They've made some alterations with some subspecialties a little bit more recently, with plastic surgery and vascular surgery, where they've combined programs now to 5-year programs. But it used to be 5 years general surgery, and then if you wanted to specialize, you would do 2 years of vascular, 2 years of plastic, 2 years of or maybe a year of colorectal. So I did my 5 years of general surgery, and then I did fellowships in subspecialties. One was hepatobiliary, which is that the gallbladder and whatnot, but it's more from a cancer perspective. So general surgeons that do their 5 years are more than adept at taking out gallbladders and the majority of the process. And I did another fellowship in surgical critical care and trauma.
Wow.
Yeah.
How was your, like, just to bring it more towards like my type of questions, like as like a normal person that's not a surgeon, how was your like first surgery like your what was that preparation like, so good that it was just like, okay, I'm ready for it?
Yeah.
Or is it still a little nerve-wracking?
Yeah, so as a medical student, you're still like eager to help out, but there's not too much you can really do as far as cutting and sewing, on the human body. So my first surgery really kind of came as an intern, which is your first year of residency.
Mm-hmm.
And I was sweating and nervous, and everything that you could ever imagine, and trying to impress my attending physician and whatnot. And he just put his hand on my hand and said, "Listen, you got 5 years. This is just number one. You're going to be doing this a lot more. So don't try not to sweat it." And it was great to have such a great support system. And it was, those nerves kind of started breaking down, and and going away after the first few weeks. And I really felt like my first 3 months as a surgical resident was the most nerve-wracking, but it was almost like a graduation. I feel like they should have graduated us after 3 months, because from where I went from the beginning to where I was at that point, I had a lot more confidence. And
in that first surgery, were you able to sleep at night? Were you still thinking about it, or?
Well, I was definitely not as prepared as you think. You should be prepared, and it's a lot of throwing you into the fire. It's like, listen, you're rounding. Basically, what you do is you round with your team in the morning. And even on day one, it's like you're rounding on your team with your on the morning. It's post-ops, pre-ops, which is like getting a patient ready for surgery, getting a patient after surgery. And then the chief resident would say, okay, Tutela, you go to room A. You're going to be working with Dr. X. You're going to remove a toe. They would say to somebody else, you're taking out a gallbladder today. Somebody else is doing an appendix, and you would just go right into it. And from medical school, you've seen it enough, you've read it in the books, but there's nothing that can really prepare you for day one, with the exception of the fact that the guy across the table has done it, hundreds of times.
Right. There's just someone,
and he's just gonna walk you through the meticulous.
Don't cut that.
Yeah, exactly. So, So as prepared as you are, you're never really quite prepared for that kind of action, but you've hopefully trained enough and have the knowledge in the back of your mind to be able to bring it to the forefront and put it into your hands.
Now, there's been a lot of times where I've known people that try to be doctors or try to be surgeons, and they just don't have the stomach for it. How have you seen any crazy story, or do you know of any crazy stories where you're like, damn, yeah, that person couldn't take, or there's some people that just, once they've seen something like that, it's just totally different than books,
Yeah. So here's a funny story. I remember when I was a small kid, and it must have been like 5th or 6th grade, and it was bring your dad to work day. And I had grown up sitting at the foot of my dad's bed. He would be at one of those carousels where they do the slideshow. So he would go through and do his dictations at home. Show the picture of the patient's. He was a plastic surgeon, so he would do a lot of trauma, sort of like facial trauma surgery. Patient day one, face kind of like mangled and whatever. Patient after operation 1, after operation 2, tissue expanders, all these crazy things. And wow. I don't know if he noticed me the first couple times, but I would just be so fascinated. I'm like, oh my God. So it kind of deadened me at a very young age. I don't want, mean to use the word deadened, in a surgical context, but it just kind of prepared me. I was like, oh, wow, I just saw all these things that almost were secondhand to me, that it just seemed like this is a very natural thing to see. So for me, by the time I got to medical school, these things seemed okay and natural.
Basically, if your dad was a mechanic, go to work with them and you'll see him with the wrench, you would okay, cool, it's something normal. But for you, it's a totally different level. I mean, it's...
Yeah, no, exactly. So I said, Dad, look, I want you to bring these slides in. He's like, I'm not really sure. I'm like, Dad, if I could do it, and again, I'm like 12 years old. If I could see this, my friends can see it, and, the teachers... So, I convinced them to do it, and I'm sitting front and center, and they introduced my father at the front of the classroom, and he starts going through his carousel. And probably about 5-10 minutes later, I was just so hyper-focused on him. 5-10 minutes later, I start looking around. There's no one in the classroom. And including the school nurse, everybody had left except for me.
Wow!
And he's like, "Brock, I think we should end this meeting." I just thought it was a pretty funny thing. I was like, "Okay, I guess I'm special."
Wow, that's crazy.
It was kind of a funny.
Yeah, I've never seen something like that, and when I was searching up about when I was in the hospital, I was searching it up, but obviously with mine it's a little different. The surgery is a little different. So, but I haven't really seen nothing like that. So I don't know if I would be able to hold, or have the stomach for that. But talk to me about the process for school. There's a lot of students out there that are in the process, and sometimes it can be hard, right? I could imagine it can be really difficult in terms of either their financials, the part of it, just studying and all that. what is some good advice that you can give to them, that they can take away from someone that's already
Yeah.
doing it?
It is it's an unfortunate major financial burden on students to understand that it's going to be close to $200 or $250,000 to go from the beginning of college to the graduation of medical school. So getting your head wrapped around those kinds of loans could be
Right.
could be pretty harrowing. I was very fortunate, and maybe part of the process that kept me going was I didn't have to worry about that.
Mm.
So I do understand the impact that could have on stopping you from following your dream to move forward with with trying to go forward with graduating college, let alone medical school. But the payoff is there. I mean, it's still going to be 10 years to pay off those loans, but it's a very doable process when it comes to the financials, but it could be very difficult to overcome. The next piece of the puzzle is trying out those sciences. Unfortunately, no matter what, you do have to get through those pre-med requirements.
Mm-hmm.
Medical school is no easy task. I kind of described my life from college to medical school was a complete 180. You could probably study, 2 or 3 hours a day and be able to play for 10 hours a day as a college student. And then the opposite occurred. I was studying probably 8 to 10 hours a day, and playing like an hour a day. As far as being able to watch TV and things like that, just stuff to decompress, exercise. Something that I always maintained throughout medical school, and that was really good for my mental health. I think it's very important to focus on self-care and stuff like that, because a lot of kids do go through depression, and it's a lot of stress and overwhelming to think that you can do this or you can't do this and whatnot. And so it's important to have a core group of friends and family and teachers to help you get through a lot of that stuff. But I always kind of say, if I could kind of do it, anybody can do it. It's just that drive and that passion. And if you have that fire in you, keep at it, even if you have to take a break and say, hey, listen, I need a semester off, or I need some sort of time to myself. I want this goal, but I'm just not ready to complete it and complete that task now. Take some time. You need to have time for yourself, because I did have a lot of friends go through some depression and things like that, because it becomes overwhelming.
It's super hard.
Yeah.
Well, I wanted to give you like your flowers too, because I'm assuming that, and I can imagine that you being on call and having to go through to do surgeries, and maybe you're at a family dinner, maybe you're like, you also have to make sacrifices as well, for your family. How difficult has that been for you?
So, I think a lot of the training process just got you used to doing, quote unquote, ungodly hours.
Right.
And you did get used to it. And it just became, this is what I was accustomed to, as far as like the amount of hours and time away from family. And it wasn't easy. It's still not easy. I think as I've gotten further and further away from the training process, I've learned to say, hey, listen, I'm in control of my hours, even if, to a certain degree,
Mm-hmm.
you are. You could say, hey, listen, I just can't do that many calls in a month. When I first started out, my biggest concern were getting through some, loans and things like that. So I just was like, hey, listen, I was already working 80 to 90 hours. Let me continue working 80 to 90 hours to pay off those loans. I had a wife that was very supporting. We had a child, and at the point where I was noticing that I just was not spending quality time with my kid, albeit, at the age of 1, 2, and 3, I kind of kept in the back of my mind. I'm like, he knows that I'm around, but he doesn't need me to the degree that maybe a 12 or 15-year-old or a 10-year-old may need his father. So my wife really provided that kind of care. She was an infectious disease, or is an infectious disease physician. So we had to do a lot of balancing and kind of tag team as far as who's going to take care of my son in the morning, who would take care of him in the afternoon. So without her and that kind of teamwork mentality, I don't know if I would have, made it to, to where I am today. So it is sacrifice. But again, back to that kind of self-care and self-needs, you got to focus and say, hey, listen, I do have some time to be able to take a step back and take some sort of control over my life and those calls. But when you're on call, you're on call. Your allegiance at that point is to your patients. You have to schedule it in with your family and and friends that, hey, listen, this is the day that I can't do something. When you're not on call, you got to commit to your friends and family as well and say, hey, listen, I'm available. Let's do this. Let's go out to dinner. Let's go to a movie. Let's go, play baseball or, whatever, football or something like that. Yeah.
So you mentioned your son. You were talking earlier that he's a little hustler and he's doing his own entrepreneur stuff. Do you think he'll follow in your same footsteps? Does he talk to you about like that he wants to be a surgeon as well?
Yeah, I don't think so. I think he sees that I work way too much. And he just doesn't have that same passion for medicine and surgery at the moment. There's been times he said, he has conveyed, oh, I do want to become a physician. But I know that his love and passion right now is kind of like entrepreneurship and he's got more of a business mind, and I'm trying to do everything that I can to cultivate and help him along and just let him kind of find his own path. I think it's really important.
Yeah, it's so cool that you're super supportive of this. It sounds like you are, because obviously you come from a background and we hear it a lot, especially as young people or young kids. We hear that go to school, that type of mentality. And there's obviously some other people that go to the other side where it's like, no, school's already over. Like, it's all about the money. It's all about this is to be your own boss. So how do you kind of, have like that line or that balance of your way of thinking? Because obviously you come, especially you're saying your grandpa, your dad, and now you, and then your son's like, I'm doing this entrepreneur stuff. Like, how supportive are you of that? And what's your mindset to that?
Very much. I'm so, he's one of those kids who, I don't want to call him stubborn, but if he's got something set in his mind, he's going to do something that he really wants to do. And if he's set to do, task A and we're asking him to do task B, there's going to be conflict. And so I've kind of gotten over trying to make him what I want him to be. Right. So specific. There's more of a generalization that I'm like, oh, you know what? He's doing something that he loves and he's got a passion for this. It's just better to cultivate what his passion is. Mm. And, I know everybody kind of like looks at the millennial generation, or now that's the Gen Zers mm-hmm. and things like that, oh, all they want to do is worry about themselves. Mm-hmm. And they should. I think we all should worry about ourselves, because, if you don't take yourself first, you don't have enough to give to others, right. So I really love the fact that he has something that's completely off from what I do and what my wife does, but he keeps at it, and he's turned it, he understands the accounting of buying and selling, his products. He does, just for the viewers, he buys and sells sneakers online, sells them on
so he got hook up.
Instagram. Yeah, look him up at Sole Providers. That's his, I guess that's his tag. So but he loves doing it. He just did, had a big Yeezy day, I think, just dropped, and his football coach allowed him to take a day off from football practice in order to follow his, his job as well.
How old is he?
He's 15. He'll be 16 November 1st.
So he got your drive. He got that hustle part of you, like that determination of making sure that whatever he sets his mind to, he's going to achieve. Yeah,
exactly. And that's the way that I look at it. I know that he's got dedication, which I think is important. He's got drive, which I think is important. Does it have to be to medicine? No, I think it's unfair for me to try to put a square peg into a round hole. If he's doing all the things and he's a good kid and he's showing up for, for school and getting, decent grades and, or good grades. He's actually getting very good grades. And is dedicated to his football team and his friends, and he's matured over the last couple of years. It's just support that, as opposed to anything else.
This new generation is it's like we're living off social media right now, right? Like
Yeah.
we back in the day there was no social media. Back in the day there was no, it was mainly what your parents would tell you you would do, right? Or like you had less of people that you would look up to because of lack of obviously exposure. So now there's a lot of promotion on entrepreneurship. There's a lot of promotion on being your own boss. Do you guys see in the medical field, do you guys see a drop in terms of people being interested or kids being interested in being physicians and being doctors? Because again, before that's what like everyone would be like, if you want to be successful, you have to go to school, you have to be a lawyer, you have to be a doctor. So the majority of people would like, obviously that was their goal. Now it's a little bit different. Has there been that type of drop? How was that?
Yeah, I mean, the only thing I could see, because I'm not there at the level of applications into medical schools, but I do read journal articles that kind of show the ebbs and flows of where application rates going up and down, and they kind of seem to fluctuate for sure with the economy. As the economy kind of tightens, I think more and more kids go to those fields that are just more. I don't want to call them the conservative fields, but the fields of law and medicine, where it's just what your path is going to be, you're going to make good money, and maybe you're focusing a little bit more on just having a guarantee of a job at the end. I think social media has expanded people's views on things and given them a lot more exposure to other fields. So I think that social media is a great thing. I think it's just a tremendous way for kids who may not have the opportunity for that kind of exposure of knowing anything other than you got to become a doctor, you got to become a lawyer, you got to become a banker or a businessman or something like that. So I think it's been a great benefit for sure. And I think application rates are still up in medicine. I'm sure they go through their ebbs and flows, but it's still a difficult process to be able to get into to medical school.
So we're still good. We'll still have doctors by the time that I'm fucking 67 years old.
Yeah.
Because that's one of my fears too. Because I think about it too. I'm like, wait, like if everyone wants to become their own boss, like I mean, we still need doctors. We still need
Well,
police. We still need.
So it's funny, our residency programs, which are the programs that train doctors from medical student to from graduating medical school to clinically active physician. So whether it's internal medicine residency, general surgery residency, pediatrics residency, the majority of those residencies, or I won't say majority, but a great percentage of those residencies are filled by foreign medical grads. So a lot of physicians or people who have graduated medical school either in the Caribbean, Europe, Mexico, and all these things fill those programs. So we're in a good place. I mean, there is definitely a physician shortage in the country, and I think there's going to need to be more of an expansion over time to be able to care for the baby boomer generation, which is now. Which is the population that we're dealing with. So I think they are making and expanding programs. If I'm not mistaken, New Jersey and New York has opened up 2 medical schools in the last few years. So that expands residency programs as well. I'm from New Jersey originally, so I don't know what's exactly going on here in California with the expansion. But yeah, the powers that be are opening up programs to help the surge of people who want to go into those fields.
So let's get into the why I had to get my gallbladder removed. I was having pain for 3 years, and the first question obviously that I have for you is there a reason why they did not detect that pain or kind of saw what was going on with that?
Yeah, so you're definitely the atypical patient to have this disease process. Gallbladder disease. It's called cholecystitis, which is the inflammation and infection of the gallbladder. Is most typically due to gallstones created by cholesterol precipitation. So basically, cholesterol that's in the gallbladder will turn into these little crystals and balls and become gallstones. That process is most common in females above the age of 40, typically overweight, obese, and that are fertile. So
Right.
the old adage, when we were trained, it was fat, 40, female, fertile. Those are the most common patients that this occurs in. But it can happen to anybody.
Right.
So if I'm not mistaken, I think the workup that you underwent prior to greeting me was more based on like gastritis,
Yeah.
and I think they looked at the more common things in your age group, which was kind of like peptic ulcer disease,
Right.
which is a different process completely and more typical in somebody your age group. So I don't know if they had not rushed, but had gone through I think you had gone through an upper endoscopy, if I'm not mistaken.
Due to my gastritis, they did do an endoscopy.
Right.
But obviously that was not like the main pain for those of you who don't know or maybe are going through it, I had a pain that would go from my rib cage to my back.
Yeah.
And a lot of a lot of the times that I would go to the hospital or seek like medical help would be what they would say it was like, oh, you have muscle spasms or you're having gastritis, because there's sometimes where the pain would now go to the front, like just depending on where I moved, that's where like the pain would kind of try to like go to. So when I would go to the hospital, they would just tell me it would, like you're saying, it was gastritis or it was my back spasms or maybe I have an ulcer, and that's the reason why they performed the endoscopy, I think it's called.
Yeah, exactly.
Just like a camera down my throat into my stomach just to make sure that everything was okay. But yeah, this last time they actually saw a rock or a gallstone stuck in one of my tubes. Can you explain to them why that happens instead of it not just taking off, or what's the difference between or what's the reasons why we have to get it removed?
Right. Okay. So the basic is the gallbladder is a storage unit for bile. Bile is produced by the liver on a minute-to-minute basis, and typically just flows from the liver into the GI tract and helps with fatty digestion, or it's really called emulsification. But just to keep things simple, it helps you digest fat specifically. So not carbohydrate, not and sugars, and not protein. It's purely for digestion of fat. So when you're in the fasting state, or when you're not eating, that drainage from the liver down into the GI tract goes through a little tube, and there's a little sphincter at the bottom. And when you're not eating, that sphincter tightens up, and the bile goes retrograde, or goes back up toward the liver, and takes a right turn towards the gallbladder. And the gallbladder is basically a storage unit for bile. When you eat, hormones within your body stimulate the opening of that sphincter and tells the gallbladder to contract. So now it's got this huge, receptacle of bile, and it squeezes all that bile into the GI tract and helps you digest fats, absorb vitamins, and all these important omegas and things like that for your body. During that fasting state, when the gallbladder is just kind of sitting there with bile, cholesterol can precipitate out. So bile is basically a combination of bile salts, cholesterol, and something called lecithin, which helps dissolve. So the lecithin helps dissolve the all three of those things. So if everything is in a perfect working state, everything goes down. When cholesterol is sitting in the gallbladder, it can tend to precipitate out and cause and create these small little crystals. Once those crystals start to coagulate, kind of like I describe it as an oyster forming a pearl. Your little pearls are these gallstones, and they just start to get larger and larger in size. And there's nothing that we have been able to create to help dissolve those stones. There's medications that can help prevent those stones from ever forming, but once they're formed, there's nothing that we can do to break up the stones.
Okay.
And as I said, the stones are made of cholesterol as opposed to stones that are formed in the kidney, which are calcium stones. Now, calcium is basically like a rock. If you hit it with an ultrasound, it'll break it up into little pieces, and it has the potential to just flush out of the system.
So the kidney stones, there is like a procedure that can be done to dissolve that, right?
Yeah, exactly.
Gallstones and
correct. So the kidney stones, you can use lithotripsy to help break it up, and the majority of times the stones will just pass naturally. Sometimes they'll hit it with an ultrasound. Sometimes they have to fish them out surgically. Cholesterol stones, which is the gallbladder type stones. Like I said, it's cholesterol. I would almost describe cholesterol stones as like chewing gum. So it kind of may deform it, but it won't break it up. So it doesn't have the ability to pass through the system.
Right.
So once you have those stones, you're kind of stuck with them.
So I had 2 surgeries, or I don't know if they were called surgeries, but I had 2 things performed. I mean, the first one was one to clean out the stone that was stuck in my tube.
Right.
And then the next one was the removal of the. Why did they do 2 different ones?
Right.
And not just one surgery? Just
sure. Yeah. So your process, you had ascending cholangitis or due to choledocholithiasis. In layman's terms, or just to make it more simple, one of those stones went from the gallbladder, got stuck in the main bile duct on its way down into the small intestine. Now, I can't go, or it's safest not to go removing the gallbladder until you've provided drainage for the liver itself, because the liver is a major metabolic organ to help with metabolism of just about everything that goes into your body. And if we started giving you anesthetics and things like that, it could, make things worse clinically for you. So the first and foremost, we clear the system, clear any infection of the body to the best of our abilities. And then when you're in a more steady state or kind of back to where you were, then it's safe to go remove those gallstones and remove the gallbladder. The reason we do it and still go ahead and remove the gallbladder, even though we've emptied the duct, is that we know in patients who these things have become problems with, that they tend to have those problems throughout their lifetime. Incidental gallstones, so patients who, were going in for something completely different, and let's say that they said patient had right lower quadrant pain, was noted to have appendicitis, and oh, by the way, we noted some gallstones. We would consider those asymptomatic gallstones. And only about 10 to 15% of those patients ever become symptomatic over a lifetime. So we say leave well and good alone. And even if you, kind of get a little crazy with, oh my God, I don't want to be one of those 10%. Of those 10%, if we decide not to do anything, only about 1% will become clinically significant over their lifetime. So it's really, really small reason to take gallstones out unless you become symptomatic from the gallstones themselves. Yeah.
So for those of you for those people that are going or that need to make a schedule, I know some people that are out there that I know for sure, because they DM me. They said that they need to make their appointment to get their gallbladder removed. Should they be concerned? How big of a surgery is this? How big of obviously every surgery has its risks, but compared to like something more serious, how much should they be worried about this?
So, obviously you want to be in the hands of, of a board certified surgeon. I don't think there's really too many places in this country you can get your gallbladder removed without that basic, that requirement. It is significant, the early, once you kind of get that diagnosis of either infection of the gallbladder due to gallstones, what you had, which was the blockage of the bile duct It could also block the duct to the pancreas. So 3 pretty significant things. The sooner the better. What happens is a lot of times patients will, the typical pain will last for about 4 hours. It's in the middle of the night. They can kind of grin and bear it. They wake up the next day feeling a little bit better, and they're just like, it's okay. I can wait for the next attack. Each attack, more and more scar tissue forms around the gallbladder, which increases the complication rate for surgery. And especially in patients that, that are diabetics or older who may not feel the pain as much, or be like, this is not that bad. I could really deal with this. I'm okay with it. The process that's going on is actually creating a more complicated situation. So the sooner the better once the clinical indications are there.
So what would have happened if, for instance, like you mentioned, like the pancreas, what would have happened if the rock would have kept on going, or if I wouldn't have taken care of that, if I would have taken pain medications and I would have just kept on brushing it off? Like, what are the consequences to that?
So in your case, the bile duct was blocked. So you would have been in the ER at some point, just becoming more and more septic. So you would have become more and more ill, requiring IV fluids, IV antibiotics, the potential, to going on a ventilator and in intensive care unit is definitely there. Small, but, possible. Usually patients can't grin and bear it long enough, and get very sick quickly that they get treated. But it just kind of prolongs the process, increases your chances for postoperative complications, including infections, possibility for an open procedure. So I typically do this laparoscopically, which is a series of small incision, camera, and long instruments. And we would have to convert to an open procedure, which is just a much longer recovery period, potential for developing postoperative hernias, adhesions, scar tissue on the inside just kind of rises and rises with the longer that you wait.
So the hernias that sometimes people get after surgeries, it's less of a possibility for me to get those because you just punctured holes basically on my body,
right?
Than if you were to open.
Yeah, exactly. So those things are called incisional hernias. And one of the great things about minimally invasive surgery, which is laparoscopic, or sometimes people are doing robotic, which is a modification of laparoscopy. So those small incisions have such small potential for development of hernia, which is part of the reason we've kind of moved towards minimally invasive surgery for sure. So
my procedure was fairly quickly. You came in. That's one of the things that I also wanted to tell you, like, really thankful for, because you were my surgeon. You actually came in and explained to me the process, explained everything that was going to happen. Obviously I was in the hospital for a week, and, as a patient, I mean, our minds just take off, and our minds just, go into like maybe negative thoughts. And we, especially now with YouTube and Google, my God, we search these things up, and sometimes you get the wrong information. And you came in kindly and told me, hey, you know what, everything's going to be okay. Everything's going to be quick. Nothing to worry about. Even when I was in the recovery room, I think you guys call it, before going into the actual room. Again, you just made sure everything was fine.
I think it's critically important, for your surgeon to be able to communicate with you. We are going into your body, violating, natural spaces. And you need to establish, I think it's very important to establish that rapport, albeit sometimes it's, in the middle of the night. Sometimes it's sudden, but still you need to take time to explain to the best of your ability, and to get your patient to understand to the best of their ability what's about to happen. It's the easiest way that I kind of describe it is that it's small incision, big surgery. We are removing an organ from your body. There are critical structures in that area that can have devastating consequences to your life long term. And you need to be aware that even if you don't understand the dynamics perfectly, at least you have some sort of an understanding that, this is a big deal. And that's really like the basic thing that I need to, right, get across to a patient. We remove it from that main bile duct, which is what was blocked originally in your situation. The potential for injuring that bile duct is there. It's less than 1%. I think it's, close to a 0.5% chance, but it's real. And it's something that you should be aware of. And it's something that I explain, hey, listen, we may be in a situation where there is so much inflammation there that I'm unable to, peel the gallbladder off of that main bile duct in certain circumstances laparoscopically, because I'm using metal instruments. I'm not using my fingertips to feel it. And I have to convert to an open procedure to more safely do that. Sometimes it's just not possible to do it, and you end up having to do a reconstruction of that bile duct, which is a major, major surgery, and can, prolong recovery in the hospital, at least a week, because of that. You could wake up with drains and tubes, and I kind of walk through that process with patients just so they kind of have that understanding. And I do try to set them at ease that, I've done this, several hundred or thousands of times over my lifetime, over a 10-year period. It's nice to be able to explain that to my patients. But, even when you're, when I was a young surgeon, or, a more novice surgeon, my first, couple cases, I would explain that to the patient. Hey, listen, this is the process. The potential for complications is there, but we're going to walk you through that process. No matter what, I will get you through the process, whether it's laparoscopically or we had to bump it up to a little bit higher level of care. You just want to be able to know that let your patient know that you're there, right, to walk them through that, and go through all the ebbs and flows with them. Because listen, even something as simple as a wound infection postoperatively may not be a big deal to me, but I know it's a great deal to a patient, right, and it puts a lot of stress. Like, oh my God, this is terrible. What's going on? And just kind of walk them off the ledge a little bit, and just say, hey, listen, it's okay. We're not, it's not too unexpected. This is how we're going to treat it. Whether we have to drain, add antibiotics, we'll kind of bring you back into the office a little bit more often. We'll walk you through the process.
And shout out to the nurses too, because they also play a big part of like the before the surgery and stuff. That's one of the questions that I was gonna ask you, because when I went into the operation room, they started playing Bad Bunny music. So I don't know if when you came in, they had turned it off. Because they're like, hey, what do you want to listen to? I mean, I was there for a week, so I was already kind of developing a relationship with them and kind of being cool with them. And they're like, hey, they asked me if I wanted some medicine to relax and stuff, because they thought that I was going to kind of start tripping out. Yeah. And I do suffer from anxiety, but at that moment I was like, well, I mean, I'm here. Like, it's not like I can run away. It's not like if they have to do this, like I'm not gonna. And then I was comparing my surgeries obviously to like more extreme. That's how my mind works. It's like, okay, well, I thank God that I'm not going through this type of surgery. It's only something like this. So like I was comparing that, and that was kind of helping me to kind of stay at ease. But yeah, that's one of the questions I wanted to ask you, if you actually heard the music when you came in.
Yeah. Some of the music I listened to was probably worse. I came up with the through the era of NWA and Dr. Dre and Snoop Dogg. So Bad Bunny is very tame compared to that. But listen, I mean, the nurses are my eyes and ears and voice. When I'm not there. So it's as important for me to establish a great rapport with the nursing staff, from the floor nurses to the OR nurses to the recovery room nurses, because every physician and surgeon is a little bit different. We all have our own dynamic way of doing things. And the more that they know that I've, kind of sat there like, oh, Tutela, yeah, he'll come in and talk he'll give you the whole
that's what they were telling
explanation. Me. He's really good at, at doing that. So they know me well enough to be able to communicate, hey, to put your mind at ease as well.
Right.
And they're also the ones to say, hey, listen, I told your patient X, Y, or Z, and he still seems nervous. Do you mind giving him a call? And I'll try to call them or get to their bedside as soon as possible to help that communication, because I think it's really, really important.
Okay, so let's talk a little bit about post-surgery. There's a lot of misconceptions. There's a lot of misinformation that I was looking up, and that's the reason why I wanted you to come to the podcast and talk a little bit about it. There's some people that say, well, after surgery you can eat whatever you want. There's some other people that are like, you can never eat any oily food anymore, like that, like all that greasy stuff, like it's over. you'll get diarrhea, you'll get, still vomit and stuff like that. So can you talk first a little bit about the recovery? Because that's something that I went through a little bit.
Sure.
And then about the diet.
Yeah. So the recovery and part of that pre-op process when I'm explaining to patients is that the pain is going to be the worst for the first 48 hours. Each day it gets better, and by about a week, most people are off narcotic medication. I usually say use the narcotic or use some sort of pain medication those first 48 hours because it takes a little bit of time for the pain medication to kick in and you'll really be suffering. In an elective setting, patients come in the morning, have their procedure done, are home by evening, and have a prescription for 5 to 10 pills, and that typically will get them past that part of the process. By about a week to 2 weeks, I tell patients to come back to the office so I can take a look at their wounds, make sure the recovery is heading in the right direction. They're not having, they're not still feeling sick or anything like that. After, as far as diet, what I tell patients is about 10%, 10 to 15% of patients will suffer either loose stools or cramping abdominal pain when they have a fatty meal. So I tell them not to stop eating fat, but to actually continue eating fat, but just do it incrementally, start at a low level and incrementally increase to the levels that they were pre-operatively. I usually tell them the best explanation would be like, on day one, don't go for the burger, fries, and shake. Have the burger on day one, have the fries on day two, and
you're talking about day one, like after operation.
Yeah, right? Most people don't feel well enough to even go that. I just try to put it in their mind to incrementally increase, and usually it's an easy thing to. When
you told me, I was like, well, I'm gonna go get some In-N-Out, then I just want to have the fries, but I was like, nah, I don't want to eat that.
Right? Yeah. Patients typically post-op, go with mom's chicken noodle soup. Yeah, that's about all you can handle the first couple days, and as your body, I tell patients, pay attention to your body. What it's telling you to do is basically what you can start to follow. So usually the first couple days, they're barely eating much because of the anesthetics that are in the system. The narcotic pain medication makes you feel lousy. Just the whole process of healing is a lot on your body, and you're not craving high calories typically at that point. But start with the simple things. But to continue having, maybe have some oil, on your chicken. Don't have the fried chicken. Have maybe a chicken breast that's that's lightly oiled or something like that. And then over time, you'll be able to get back to where you are. And usually by about 6 to 8 weeks, you should be noticing nothing more than the scars on your body.
Okay, so because TMI for that's watching, I still am like going through the GI phases of loose stools and constipation, then it's loose, and then it's constipation. It's like I don't know if that's like my body adjusting to.
It's definitely within the normal range of things. Everybody's a little bit different. You can suffer these kind of consequences of your GI tract just not getting back online for up to a year. We also give you antibiotics during the process, and that could just change the entire milieu of your colon and the bacteria that are there to help digest, help in the digestion process. So there could be many reasons why you're not perfect yet. Just to stay kind of encouraged, probiotics can help with some of that symptomatology and getting that GI bacteria microflora back in track. So definitely, continue doing what you're doing. Know that it's going to be, everybody's a little bit different. Like I said, you're at a much younger age for developing this. So the consequences may be a little bit more substantial in your situation because you've been living with a normal gallbladder for your entire life.
Right.
Patients who undergo, or who have had multiple attacks, their gallbladder hasn't been functioning at 100%, so they may be able to tolerate the removal a little bit better than someone who's had, a gallbladder that's really been functional at 100%, all their lives.
Right. So let's talk. This little part is gonna be for my mom because she doesn't let me drink soda, and a lot of people
Smart woman.
a lot of people give me shit.
Soda's poison.
So I'm like, my biggest craving in life is Coke. Like
Yeah.
a nice,
Oh yeah. Nothing like
nice
it. Yeah, absolutely.
cold with ice. Like
Yep.
that's my thing.
Yeah.
First, what's that? Is there an actual cause for gallstone? Like, is there, like, for instance, the kidneys? I would assume it's like the soda, right? Or like the.
It can be calcium acetate. Can be precipitated by some of the things that are some of the sweeteners and things like that. At least theoretically, I'm not a urologist or someone even that deals with kidney stones, so I don't want to speak too much on it just because that's not my level of expertise. The gallstones, like I said before, are cholesterol stones. And it's part of what we call the metabolic syndrome. So there are patients who are morbidly obese, have high cholesterol, and diabetes and things like that. So it can be part of that type of patient, obviously not someone in you. And again, it's the precipitation of the cholesterol while it's sitting in the gallbladder. We don't know 100%. It's not like patients with high cholesterol all get gallstones. We just know it's part of the metabolic process that's going on while after the cholesterol has moved past the liver and being stored in the gallbladder as part of the bile. So it's a weird thing.
Okay, so let's see. There's a bag. The bile comes down from the liver, and when you're not eating, it goes back up and it stores in the bag. Correct?
Yep.
After you remove the gallbladder, there is no longer that bag.
Right.
So is there a possibility of me developing gallstones again? Two, how does that work now directly?
Yeah. So now the body recognizes that you no longer have a gallbladder, so you no longer have that gush of bile to help you with digestion of fats. So that's why you kind of take it easy. I tell patients kind of take it easy with fats, not take fats, but to take it easy with fats the first few weeks. So the body's response is, oh boy, we don't have this big gush. Liver, start picking up the production of bile. We need more bile in the GI tract on a minute-to-minute basis than we used to. So the body does respond. It takes some time to do that. Second thing is that sphincter just kind of remains in a more open position as opposed to opening and closing. And the bile duct actually will increase in size to support that flow of bile. So over time, the body picks up on the process that it needs more bile. The body reacts mechanically as well as physiologically, chemically to the process. So it goes through an adjustment process. It's not unheard of for people to go through that constipation, loose stools, cramping for up to a year. It's really rare, but it does occur. And support with the patients is definitely critical during that time period. Sometimes if patients are really unhappy and just unable to tolerate some of this, I'll refer them to a gastroenterologist who are more adept at dealing with the medical treatments for that. And sometimes there's things and medications they can give to help support that process.
Okay, and then last question: when because the liver is in charge of releasing bile, now that it, like you're saying, it's sending signals to be like, hey, you know what, we need more. Is there a possibility if people, like, for instance, if I go back to my past diet where I just ate a bunch of junk food, a bunch of unhealthy stuff, could I strain or hurt my liver because I'm requiring it to pump faster I don't know how it works,
Right.
but like, am I gonna hurt it later on? Can I develop a fatty liver because I'm eating that type of food, or does that have nothing to do with
two caveats to that. So one, if you do it too quick, you're going to get cramping and loose stools, so that your body's going to say, hey, but it's not going to cause damage to your liver itself. Definitely not in the short term. Fatty liver is a real significant consequence of eating eating poorly. So having having your body not regulated with cholesterol's 50-50 familial and diet. So there's part of it that you can help, and there's part of it that you're kind of stuck with just having high cholesterol that can lead to a fatty liver or just metabolism of fats. And having super sugary foods, your body responds by having all that sugar and converting it into fat. Whatever's happening on your belly is happening on the inside and happening on all of your organs, and can have consequences of a fatty liver as well. Fatty liver, if I see it during surgery, I'll tell patients, hey, listen, you have a fatty liver, you need to be aware of it, because typically a fatty liver can occur over a long period of time. It also can occur with binge drinking. And eventually, whether it's alcohol related or not, that fatty liver will convert to cirrhosis. Cirrhosis is scarring of the liver. And once you have a scar, you can't dissolve a scar. So there's nothing that you could do about that. You could stop it from getting worse, cirrhosis for sure, but you can't reverse it. A fatty liver you can reverse. So whether it's from binge drinking or whether it's from eating kind of crappy foods over a long period of time, you can adjust, you can modify your lifestyle choices and be able to make a fatty liver back into a normal liver.
Okay. So I can still eat those enchiladas and
you got it. Don't exactly. Don't stop it completely. Just everything in moderation.
Oh, great. Well, I appreciate you for being here. I want to first obviously thank you for being here, and then also thank you for being my surgeon and making the process easy and explaining everything, and now bringing value to everyone that's watching. Is there any last things that you want to say to anyone or to everyone that's watching?
No. Thank you for letting me be here and explain to your people exactly what happened and how the process typically goes in my hands, and I think most surgeons do things in a very similar way. So like I said, as long as you have a board certified surgeon, and when it comes to referrals, definitely getting referrals from your medical physicians is just sometimes as important as getting referrals from friends and family who have had good experiences,
right,
from a different perspective. So it's nice to have both, a doc that recommended you, as well as a friend or family member that recommended you from the seat of the patient. I think it's just a little bit easier to absorb all that information and kind of take things from there. So.
Yeah, no, and for people that are out there, that I know there's a lot of stubborn people and hard-headed people that don't like to go to the doctor and don't like to get checkups, and I think you guys should, man, because you can avoid some more serious, situations, and I know people are scared to go to the doctor because they're like, nah, I'm gonna go and then they're gonna tell me I have diabetes. I'm gonna go and they're gonna tell me that I'm sick, and then it's gonna mess with my mind, and then it's gonna just. But I've been dealing with this for 3 years, and I would go to the doctor and check up on that, and there was times where I was taking medication to kind of just prevent pain and just kind of overcome that. But I could have made everything, like you're saying, a lot worse. And yeah, I just would advise everyone out there that if you're feeling bad, and you've been feeling bad for a long time, just try to go to the doctor and get a checkup, your yearly physical checkups, because you can make a difference with that in terms of your health. And
yeah,
I'm going to start eating healthy. So
no, I always, when I ever come across either a friend or an acquaintance or someone like, I'm not going to go. And I just kind of tell them, look, talk is cheap, right? Mm-hmm. It will never hurt for you to walk into a physician's office and at least hear their perspective. And you could walk away making your own decision. You need to make your own decision. I think it's very important. Right. But it's always nicer to be empowered with knowledge than to, rely on, like you said, the Google pages. And use that information to kind of, be able to get the questions you want to ask to your physician, but go see a physician. It doesn't hurt to have a quick conversation. And if you just don't jive with that physician, find another one. There's, we're definitely in an area and at a time where
there's information.
That there's a lot of information. There's a lot of good docs out there. It's just your job to find, to put those pieces together.
And talking about information, he's gonna start a YouTube channel now, and we're gonna
absolutely.
We're gonna put him to that. And so if you guys, we're gonna leave his links down below. We'll leave his Instagram and his YouTube page. He's gonna create that. That way, if you guys have any questions, you guys can DM him directly, or you guys can message him, leave comments on his YouTube page. He started doing videos on information about what he does, and again, I appreciate you for being here. All right, guys. Well, thank you guys for watching. I appreciate everyone who stayed to the end. Don't forget to like, comment, subscribe, and we'll see you guys in the next one.
Perfect. Awesome, man. That was awesome. That was great. Yeah, that was really
I was still
fun.
a little nervous because your level of vocabulary, I was like,
shit. I was like, I want to say the big words so people have them, but then I was like, I gotta bring it back down to.
Yeah, that's why I was like, I was kind of getting stuck. I was like, damn.
That was great, guys. You guys did good.